When we're looking at a communicable disease control system that functions properly, there are different functions, including surveillance and laboratory testing, preparedness and response, evidence-based prevention policy, and then public health communications. And then there are enablers that allow these different functions to happen. So leadership and governance, skilled people, information systems and research capacity, financing and infrastructure, and partnerships and networks. And for this particular talk, we will focus on the first function, which is surveillance and laboratory testing. Now, public health surveillance, why? It's the core element of public health practice. It identifies the emergence of an outbreak, it categorizes its natures, and it identifies those affected, all for the purpose of containing the outbreak. What does public health surveillance entail? It's a process that involves mainly data collection, which can be collected in many different ways, from laboratory specimens, from vital records, from sentinel surveillance, from administrative data, from registries, from the WHO notifiable diseases. It involves data tabulation. And there, they usually divide it into three: the time of exposure or reporting. The place of exposure is typically the most important area, but sometimes it's just the place of reporting where the disease was first reported. And then factors related to the person who has the disease, anywhere from demographics and age and different factors so that we can identify. Then you have the data analysis components, and usually it's descriptive data, but then also you have analytical data processes. And you have the data interpretation, which is understanding what were the main causes of increase in cases. Sometimes it's just because you have more active surveillance happening. Sometimes it's really because there is an outbreak happening. Then you have the data dissemination, and which is the process of to whom do you inform so that there's a reaction. And all of this is to link to action, to develop interventions and policy in order to prevent outbreaks from containing the outbreak in general. Now, an ideal surveillance system, an early warning system, it delivers real-time data showing the number and locations of person with a specific illness in the affected area. And then it enables rapid collection analysis of patient epidemiological information to determine the sources of exposures to agents. And here I borrowed a slide from Afghanistan, where they have an early warning system that is very well organized, where they have sentinel surveillance at particular sites. The information flows to a regional location, and then that information then flows to a central location, to the Afghan National Public Health Institute, where they have a combination of epidemiological surveillance and then laboratory testing, advanced laboratory testing. Once their information is collected there and data analyzed there, they then send the information directly to international agencies such as CDC, EPI, or whatever programs. Now, what is innovation? And innovation is ideas translated into value. It's something, not just something new, but something that makes something better. And I think that, a lot of talk has been happening about innovation, but we want to make sure that the innovation that we put in place is something that actually solves a problem. It is something new, but it is something that makes things better. Now, in surveillance, a lot of the innovation is happening when we're looking at traditional ways of conducting surveillance. It's usually once there are some clinical cases at the, and I'm not sure you can very clearly see the slide, but at the bottom is usually when there are some clinical manifestations. They go over to the health facilities, and the health facilities then usually at the community, go over to the district level, inform them there. And then from the district level, it flows over to the control program. And then from the control programs, it flows over to Ministry of Health. It's the traditional way of doing surveillance. And when we're talking about innovation and surveillance, it's somehow when there's an important outbreak happening, that the information flows more quickly from when there's even asymptomatic cases or the clinical cases, that the information flows more quickly to the level of the Ministry of Health, so that reporting can be done at an international level or regional or international level at a faster pace. So the innovation is happening on the right side of the slide, as you can see. More, and then also more active surveillance being conducted, or better ways of collecting data, more innovative ways of collecting data, some mapping and some data analytics. So, and that was just showing a little bit on a slide where the innovation is happening in the scheme of surveillance, but more particularly in surveillance, what innovation is happening now. We have a slew of new assessment tools that have been developed. There's more of an approach at looking at systems and networks versus facility-based data collection. There's also more of an integration of different health sectors between human, animal, environmental health. So tools are encompassing all of those factors in a One Health approach. And then we're involving more and more of the community and doing more active contact tracing. That was something that Ebola showed that, active contact tracing was a good way to contain the outbreak. And then also teaching some of the community health workers how to recognize specific symptoms and report them to the proper authorities. So really involving the community more, particularly because a lot of the outbreaks are happening at the community level, out in the outskirts, not usually near urban centers. And then the mobile phone technology has revolutionized a lot of how the reporting is done, where there's no internet access. A lot of times there is mobile phone technology, so you have SMS reporting and different methods of reporting information where it's not just paper-based anymore. Then a lot of effort has been in electronically linking reporting systems. Used to be the laboratory information systems were separate from epidemiological reporting systems, and so now a lot of efforts are being done where you have the laboratory information systems talking to EIDSR reporting systems, for instance. Then there's some new mHealth approaches where you have participatory surveillance, analyzing call data records and satellites and information. And then also this new drone technology where it's currently being piloted in a lot of countries for sample and emergency supply transports. And then another area of innovation has been around data collection. A lot of effort has been on the geospatial data, where you have information about the whole geography and the landscape and population density and transport systems, all of it juxtaposed so that you can generate comprehensive estimates of how the disease may have been transmitted. You have also looking at, and this is more looking at the mobile phone data, it's more looking at the subscribers, because you have a lot of countries where there are situations where people move a lot, where there's a conflict, and so this at least provides information about the location and movements of subscribers in real time. And then you have genome sequencing, which looking at the configuration of the pathogen, and then it provides these provide complementary insights into transmission chains and pathogen gene flow between locations. Now I'm going to talk about African Society for Laboratory Medicine, where I work. It was established since 2011 in Addis Ababa to enhance professional laboratory practice, science, and networks. The 5 pillars of how we conduct laboratory capacity building is really establishing laboratory networks within countries and regionally and internationally, developing the workforce, insisting on quality and then trying to move labs towards accreditation, whether it's national and then eventually international accreditation through processes like SLIPTA. It's to work in the regulatory sector where we're trying to regulate certain devices and regulate the practice of laboratory science in Africa, and then through communication and partnerships and then knowledge transfer. I've been at ASLM for the past 2 years. Now we're working we have 2 projects going on that are quite innovative, and as we know, laboratory-based information is key to surveillance. It has to be accurate, it has to be timely, and it has to be quality assured. And then, national referral networks in most African countries are still weak, and even in outside of Africa. So we have embarked on 2 projects where we're doing geomapping, or that's the geospatial data collection that I was mentioning before. And then we've developed a new assessment tool as well that's looking more at looking at laboratory systems and networks in Africa, as opposed to going to each facility to try to collect information. And so the purposes of these are all to optimize laboratory networks and then improve surveillance and disease control and laboratory practice in general. Now, our laboratory networking project has been financed through a project through funds from the Bill and Melinda Gates Foundation. We're working in collaboration with many partners, including Africa CDC. And like I said, it's a geospatial data collection. So we did have information about where many of the reference laboratories are located in Africa in terms of certain programs, disease programs like the polio program. But we didn't have information in many countries specifically about what their laboratory networks look like and what their laboratories look like outside of the reference laboratories. And so we developed a new tool that really collects country data, and also with the information that we collect from our SLIPTA assessments, and we incorporate all the information in an ASLM interactive platform. It's also, we use the DHS I2 system that also many countries have adopted, using that information as well. We collect the information that would enable us then to simulate what an optimized network would look like, and then help the countries and help us help the countries develop make some decisions and improve performance of the laboratory systems in general. And we also juxtapose that information with information that they have on disease prevalence, and then also information that they have on transport systems and just how the environment looks like in the overall country. So what type of data are we collecting? We collect laboratory and health facility location, so geo-mapping location, identity and the level, their testing capacity, the test menus and the test demands and the volumes, the equipment capacity and technologies, and then the types of instruments that they have that are connected there. The facility readiness and capability, so looking at their level in SLIPTA, how far they are towards accreditation, and then their linkages to networks such as for external quality assessment, and then dried blood spot sample referrals, and RISLNet, the Africa CDC RISLNet, as well as their human resource capacity. And we're piloting this tool in 2 countries right now, in Niger and in Ethiopia, and we're working with a technological group called Instead. And they're helping us to develop the tool, and then also do a little bit sample modeling. And the idea is then to apply this methodology to the whole continent. So we have standardized information, and then we could really have a mapped visualization of where all the laboratories are located on the continent. And then the example, these are just couple of examples of what we can do with that information. So the idea is, for example, to be able to develop in a country an integrated, less than 48-hour turnaround time sample transportation system. If we have information on what the topography looks like, what their road system is, where the population density is, do they have access to electricity, what's the disease prevalence, what are the funds available, and then this information that we're collecting on laboratory capacity, we can then do data analytics that would then allow us to optimize what a sample referral system could look like that would be cost effective and that would have the largest coverage in a country. Another example of what we could do with the data is just try to figure out where some of the instruments that we need to put in, for example, point of care testing, what would be the optimal areas, where is there no laboratory capacity, and where we should optimize locations of certain point of care instruments and just instruments in general, maybe that do need laboratory infrastructure to support them. And again, using the variables that we collect to be able to do the analysis and then just optimize location. And the second area of innovation that we've been working in for the past year and a half has been we've developed a new assessment tool. Typically, a lot of the laboratory assessment tools were facility-based, so you would go into a facility and ask the specific questions about whether the facility has capacity, very much like we do when we use the SLIPDA tool, which is important as well. But in complement, we've developed a new assessment tool that we call the LabNet Scorecard. And that looks at the network and everything around how the laboratories are linked. Do they have information systems? And I'll go a little further into that. So the LabNet Scorecard covers the essential normative standards for the laboratory system networks, and it's aligned with the WHO GEE tool that our representative from WHO mentioned, JEE tool. So it gathers pretty much information from WHO Maputo Declaration, the IHR, the IDSR, FOA, and then GHSA. And it measures the capability of maturation of the 9 essential functions of the laboratory network. So it's a more in-depth look at the laboratory networks than would offer the WHO JEE tool. The JEE gives you a broad picture, whereas this goes and drills down a little bit more specifically into the laboratory network. So the 9 essentials, we look at whether there's a political, legal, and regulatory framework, whether there's structure and organization and how the laboratory network is set up, network coverage and rapid response, whether there's a laboratory information system, a LIMS system, the infrastructure of the laboratory, and then human resources, the quality of the laboratory system, whether there's biosafety and biosecurity standards, and then we work with the countries. They've identified what are their priority diseases, and so we use the tool to determine whether the laboratory network is capable of responding to those priority diseases. And then we've developed a color-coded scoring system where from stage 0, which is in black, all the way to stage 5, where there's been attainment of international standards. And pretty much once we've done the assessment, it gives us a sort of color-coded scheme like this, where in red you have the lower stages, and towards the yellow you have some of the middle stages, and then the black, as you see, has a score of 0 where they have no capacity in that area. It gives you a very good visual of, for each of the 9 essentials, where you stand in specific areas and where you can address certain interventions. And I give an example here that Senegal has allowed us to share. It helps really target interventions. We did the LabNet Scorecard assessment in Senegal and identified that the structure of the tiered network needed work. And then there was no AMR prevention strategic plan. So it helped really to drill down and to determine where the limited resources need to be targeted to be able to address which interventions needed the most work. And it helps you with resource allocation. We also use the tool in helping countries develop their strategic and action plans, laboratory strategic plans and action plans. And so that's pretty much the coverage. And I just wanted to say, when we think of innovation, let's make sure we're more to the right as opposed to the left. So thank you very much.